Everyone, switching gears here, the Food and Drug Administration taking a new approach in its administration of the monkeypox vaccine. So the Public Health Agency will now allow healthcare providers to administer the shot intradermally instead of subcutaneously, meaning that the needle will now go between layers of skin rather than the fat layer underneath of it. The White House says that this will increase the supply of doses as much as fivefold, as the intradermal vaccination induces a more potent immune response and requires lower vaccine doses. Joining us to discuss, we've got Yahoo Finance's senior reporter Anjalee Khemlani. Anjalee, what did I just read?
I was going to say, I'm very impressed that you even understood what you read just now. Okay, so what we have going on is the FDA basically saying that they're trying to expand the number of doses that are available. We know that there is a shortage of the vaccine against monkeypox, and we know that they're not expecting more supply to come in until next month, late in next month, and that's true globally because we're relying on just one vaccine producer, that's Bavarian Nordic, to supply these doses. They've been struggling with manufacturing over time and have come up on a shortage. And this despite the fact that we had a national stockpile of treatments and doses. So the fact that we're facing a shortage in this country is just a result of, breakdown in the system. But what we're looking at is the justification for this that the FDA has given us is that they did already do a study that showed that it was equally effective when you put it in under the skin versus subcutaneously or into that muscle layer. And the reason behind that is, the reason why they haven't done that is because just intramuscular is a more common method. Intradermal, which is that new method under the skin, it's harder to administer, right? That's why they're not shifting to that for kids. Imagine pinning down a kid and trying to get them.
My gosh.
Exactly. So that's what the reason is. And we had Robert Califf, who is the FDA commissioner, explain the logic behind that yesterday at a White House briefing. Listen in.
Data from a clinical study of the vaccine published prior to its approval in 2019 evaluated a two-dose series given intradermally compared to subcutaneously. Individuals who received the vaccine intradermally received a lower volume, 1/5, than individuals who received the vaccine subcutaneously. The results of this study demonstrated that intradermal administration produced a similar immune response to subcutaneous administration, meaning individuals in both groups responded to vaccination in a similar way.
So there's been a lot of criticism about this approach, the fact that there aren't greater, more in-depth studies about this, but we do know that there is at least some level of data to support this idea, and so they're just extrapolating on it. There are some concerns about whether or not this will impact the effectiveness of the vaccine. Right now, this vaccine does not prevent monkeypox. It does just reduce the severity of the impact, so a lot there. And this, of course, as we keep an eye on the growing cases across the country. Now we're at more than 9,500 or near 9,500 in the U.S. alone, accounting for the #1 spot globally. And we're keeping an eye on really everything else that the administration is doing, declaring it an emergency, gathering that team and looking at these treatments and vaccines that are available so far. And that's just where we are at.
All right. Well, interesting that there's a new tool, at least, or a new
method.
Thank you very much.